Good morning, everyone. I'd like to welcome you to NB Lung's 31st Annual Respiratory Health Symposium. Next, we have two people presenting together. We have Jamie Laking and Kizzie McGilligan. They're going to talk about navigating vaccine hesitancy, insights, and approaches. Jamie Laking is a Fredericton-based registered nurse with 17 years of experience, including the past 9 years specializing in public health. Her diverse roles in public health have included working with healthy families and healthy babies, assisting with contact tracing during the peak of the COVID-19 pandemic in the communicable disease unit, and contributing to immunization efforts aimed at preventing infectious diseases. Jamie's had the opportunity to mentor both nursing and medical students. Her passion for immunization was particularly evident during the COVID-19 pandemic, where she played a crucial role in the success of the immunization campaign. We also have Kizzie McGilligan, and she's a dedicated public health professional based in Aroostook, New Brunswick. She's a Bachelor of Nursing from the University of New Brunswick and over a decade of experience in healthcare. She's actively involved in the immunization program for the Upper River Valley area. Kizzie's passionate about community health and continuous professional development, and she's currently completing a certificate in nursing leadership and management at the University of New Brunswick. She's committed to fostering wellness, health, and education in her community. But now I would like to turn the screen over to Kizzie and Jamie, and thank you both for being with us today.
Thank you, Sarah, for that introduction. So as Sarah explained, we're both, Kizzie and myself are both public health nurses. And the New Brunswick Lung Association had reached out and asking if we could provide some guidance around vaccine hesitancy. So we put together some insights and some different approaches, and we hope you find our presentation informative.
Hi, everyone. We're going to start with the first slide. We're going to begin by defining vaccine hesitancy. Vaccine hesitancy is a delay in accepting or refusal of vaccination, even when vaccination services are available. Vaccine hesitancy is a complex issue that is specific to context, varying by time, location, and type of vaccine. It is influenced by factors such as compliancy, convenience, and confidence.
Perfect. So things may not be as they appear. So in April of 2023, Kizzie and I had the opportunity to attend the Canadian Immunization Conference in Ottawa that is held annually, where we had the chance to select from a variety of presentations to attend. Myself had the opportunity to attend a session on vaccine hesitancy, where the speakers began with an activity that I found incredibly impactful and insightful. So Kizzie and I have decided to incorporate this approach and share an activity with you. This activity will focus on exploring our emotions. So for this activity, everyone's going to need their cell phones. You'll be shown a series of slides featuring 3 different images, with each image having a total of 3 slides. So how it's going to work is the first image that Kizzie's going to show, you're going to have about 20 seconds roughly to examine that slide. Determine how that makes you feel. The second slide is going to bring up a QR code that you're going to scan, and we're going to be able to see in real time as you express your emotion for that image. And then the third slide is going to be that image in its full. We're going to go through the 3 different ones, and then at the end, we're going to open it up for a discussion to see how you found this activity. Perfect. So that's our first image. And then here's the Slido where you're going to scan the QR code and then start putting in how that image made you feel. Perfect. So then this is the image in full. So just take a moment to just kind of look over what the image was in its full. And then this would be our second image. So this takes some time to get an idea of how you feel about this image. And now we'll give you some time to indicate how you felt about that image. And then this is what that full image is. And this is our final image to see how you feel about this one. And then we'll give you some time to indicate how you felt about that image. And this is the image in full. And to put it into context, that's 9/11 with the Twin Towers going down and behind. Perfect. So how did this exercise make you feel? So this is where we would like to open up and see how this made you feel. So we're bringing up the images again. And just wondering, did you find your emotions changed? Did you find you remained the same? Were you surprised by what the full image was?
I know when we did it with our coworkers, before we presented with you guys, a lot of them were really surprised at how different their feelings were before they saw the whole picture compared to after they saw the whole picture.
Yeah. So the purpose behind this is looking at that perception versus fact. So reflecting on it, you can see how perception might be limited if you don't consider the bigger picture. So our emotions play a role in how we view vaccine science. Emotions make it challenging to tell the difference between factual and false information, and emotions can cloud your judgment. We know there's reliable information available from various sources, but there is also information that may seem credible while actually presenting an incomplete picture, showing only what the source wants you to see. Typically, these sites aim to provoke strong emotion. So with the exercise, there's two pieces of it. So as the immunizer, like Kizzie and myself are very passionate about immunization and its importance. And we have to be mindful of our bias on how passionate we are when we're dealing with the public, and especially if we have somebody that's kind of on the fence about immunization. And then there's the other side of it that information out there on the net, we know, is not the full picture always. So it's just being mindful of a couple of those different points, being the immunizer versus being the person being immunized.
So now that we've discussed how vaccine hesitancy can affect individuals' perceptions, we now want to discuss how you can approach a vaccine hesitant person. This 5-step approach is from the BC Immunization Communication Tool, which you can access online, and we find it a really helpful resource. So step 1, assume that the person will immunize. Use a presumptive statement. A presumptive statement has been found to be more effective in increasing vaccine uptake instead of a participatory one. An example of a presumptive statement could be, your son is due for his 4-month vaccines. We will give those vaccines before you leave today. An example of a participatory statement would be, what would you like to do about your son's 4-month needles today? Presumptive statements are more effective, participatory are less effective. At this point, if the person consents to immunize, then we wouldn't move on to any further steps. It is also important not to plant a reason for hesitancy in someone who already supports the vaccines. So if they were choosing not, we're still hesitant at this point, we would move on to step 2. Give your strong recommendation. Studies show that parents consistently rank healthcare providers as their most trusted source of vaccine information, and that the strength of recommendation from the healthcare provider can influence a person's decision to vaccinate. Your strong recommendation is crucial for vaccine acceptance. An example of a statement you could use would be, I strongly recommend your child get these vaccines today. These vaccines are very important to protect your child against diseases. If the person at this point consents, then you would immunize. And if they are still hesitant, we would move on to step 3.
So in step 3, we're going to explore the reason for hesitancy. We're going to listen to what the person says. We're going to use motivational interviewing techniques to understand their concern. Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. Its aim is to strengthen a person's own motivation and commitment to their goals by eliciting and exploring their own reasons for change within an atmosphere of acceptance and compassion. So they use the acronym OARS, which stands for open-ended questions, affirmations, reflections, and summaries, is one of the foundational skills of motivational interviewing. So examples of OARS. So the scenario I've used is, I have heard that vaccines can cause autism. So an example of an open-ended question would be, can you tell me more about what you have heard? An example of an affirmation, you are looking for trustworthy information. A reflection, I have a couple here. You have heard there is some connection between autism and vaccines, or you can go a little more powerful with, you have read information claiming that vaccines cause autism on the internet, and you are wondering how to prevent your child from getting sick. So in summary, autism frightens you. You have a family member who is autistic, and you wonder if vaccines could have caused it. Do I have this right?
And then from there, if they are still feeling hesitant, you can ask to address their concerns. And if the person agrees, it's important to properly deliver information to address their concerns. One way to do this is the ask, provide, verify approach. In this approach, the healthcare provider will ask the person what they know about specific reason for their hesitancy, provide information to address that issue, and then verify that the information has been understood. After providing information and verifying their understanding, it can be helpful to summarize the key messages. And then from there, we move on to step 5, and then you would ask to immunize again. And an example of this could be, I hope I was able to address your concerns regarding safety of vaccines today. I really want to ensure your daughter is protected from diseases. Can I provide the immunizations now? If the person consents, it's important to immunize within that same visit. If they're still hesitant, it's still really important to keep the door open. I know an example of this could be, I know you have your child's best interests at heart. If you ever want to discuss anything further, please give me a call.
Motivational interviewing is a communication technique based on compassion and acceptance, designed to encourage behavior change using a patient's own motivations. Let's see it in action with people on the fence about getting the COVID-19 vaccine. Here, the patient is afraid of the vaccine side effects. First, validate the concern and let the patient identify a personal benefit. Then offer solutions based on the patient's initial concern. This patient is worried about the speed with which the vaccines were developed. First, restate the concern, validate it, then affirm their efforts to learn more. Summarize the conversation and ask to share what you know. Lastly, this patient feels the vaccine conflicts with their personal values. After validating their point of view, ask to round out the conversation with some medical facts. That's motivational interviewing. As you can see, it's about being a guide, not just an expert. By working at a free clinic, you play a valuable role in people's lives. Motivational interviewing can help you guide patients to do what's best for them.
Okay, so in summary, we would like you guys to take at least these 3 main points. The first being, be mindful of your emotions. Acknowledge that your own bias and how that can impact your view on things. The other one is factual versus false information. Please ensure that you're getting information from factual resources.
And lastly, understand the individual from their point of view. Take the time to listen to a person's concerns by using presumptive statements to draw out more information from them. Thank you.
Okay, does anybody have any questions? I don't have any in the Q&A here, but you still have time to pop them in for Jamie and Kizzie. That was very informative, really great motivational techniques for interviewing. I think we've all face the challenge of immunization questions from people. So that was really helpful for all of us, I think. Not seeing any questions pop in there. Okay, well, I'd like to thank you both for your time. That was great information. And I think especially for students starting out, that's probably really great techniques. So thank you so much.